If you come across an accident scene like this, there are many factors that need to be considered. These include who will take charge of the accident scene and any bystanders? Who will take charge of the first aid treatment? Is it safe to approach the patient? Do they need to be treated or perhaps moved away from danger? Have you got all the kit with you that you may need? Or do you need to send someone for a first aid kit, blankets, etc.? Who is going to call for help if necessary? And finally, will anyone else start to suffer by remaining with the patient? Many of these questions can be answered by doing a step-by-step scene assessment as you approach the accident scene. We recommend using the acronym CLAP. This stands for C. Control the situation. Stop. Don't panic. Take a deep breath first before just rushing in and becoming part of the accident yourself. L. Look. Look for potential hazards. Quickly scan the area for anything that could cause harm to you, the casualty, or bystanders. There may be broken glass, moving traffic, live wires, chemicals, electricity, etc. Being aware of the hazards protects you and also those at the scene. Remember, sometimes all you can do is dial 999 and call for professional help because the scene is too dangerous to enter safely. A. Assess. Assess the situation. Question the casualty and/or bystanders at the scene. What happened? Was lots of force involved? If there are injuries caused by force, this is known as trauma. So, keep the patient still until you have assessed any injuries that might be made worse by them moving. Does the patient have a medical alert bracelet, wristband, etc. that may alert you to a relevant pre-existing medical condition? P. Protect and prioritize. Protect yourself and the casualty from cross-infection by wearing suitable gloves and face shields. If there is more than one patient, you should quickly prioritize what order you should treat them in. This follows the order of our ABC assessment. A closed airway, A, is more important than a bleed, C. However, the patient with a closed airway will be unconscious and quiet, whereas the bleeding patient may be screaming and call you over. So, go for the quiet patients first. This process of prioritizing patients is known as triage and comes from military principles to prioritize for those who you can save. It is still important today, especially in mass casualty situations such as terror attacks. Get as much help as possible from bystanders and get the required information to the emergency services. Remember, the emergency services will not come unless you call them, and they will not prioritise your accident unless the correct information is given to them. You can speed up this process, potentially saving the patient, by being clear, concise, and straight to the point. There are many mnemonics you can use to remind you what to tell the emergency services, such as chalet, slide, etc. In our experience, they can be useful to make sure you've thought of everything you need, but can also be a hindrance if you try and give the emergency call handler information in your way. Better just to answer their questions in the order they ask them so they can quickly collate it and dispatch assistance. So, to summarise, it's important to check for danger first before approaching an accident scene. Quickly scan for hazards and make sure you don't become part of the accident yourself. If you have barriers such as gloves or face shields, use them. Check the quiet people first. They might not be breathing. Make sure the emergency services have been called, either by yourself or a bystander.